The Ministry of Health is making a direct and deliberate attempt to improve the quality of health care and to expand the scope and range of health services being offered in the BVI. Chief Medical Officer Dr. Irad Potter says the quality of health care in the territory is as good as anywhere, and the Ministry of Health is improving its capacity to set standards for healthcare delivery in the public and private sectors by instituting clinical care guidelines. One such guideline, he says, is the electronic recording of health-related transactions.
One of the things that is happening both in the public and private sector currently is that the recording of health transactions is becoming electronic. What this does is that it helps to ensure that the processes that are prescribed to be followed for a particular condition are followed, and that there is available evidence to audit. So periodically they'll be instituted for healthcare in the territory audits. In some countries you can go online and you can check for a particular facility what is their track record for a particular kind of procedure. Those are the things that we are aspiring to be able to do within our own country.
The Ministry of Health is also modernizing all laws governing the registration and certification of healthcare professionals. This, along with the expansion of the scope and range of health services offered locally.
By partnering with providers from other jurisdictions. Within the private sector, this has been happening for years. Within the public health system, on the ground, People's Hospital has partnered with Hema Health. There are other discussions with other providers from Panama, from Miami, from the UK. There's been visits to other territories to look at what services could be accessed overseas, so that when there is need to refer patients overseas, we have an awareness of where we are sending people and what the quality of service is, where they are going to be going. All of these things are part of the initiatives that are being put in place to ensure that we do improve the quality of healthcare.
According to Dr. Potter, residents continue to access healthcare abroad instead of using their local healthcare services. To address this problem, he says government is making a deliberate attempt to improve local healthcare services to satisfy the needs of residents.
The delivery of health services in the territory is very dependent on persons in the territory using the health services available in the territory. If we don't use our own health services, there is no way we are going to be able to afford to improve them. Part of our dilemma right now is that a lot of persons prefer to access care overseas. Well, healthcare dollars spent overseas cannot enter into the BVI economy, neither for investment in the health services or for any other aspect of our country. And so there is a direct and deliberate attempt to improve the quality of services that are available, so that when people access services, they are happy with the quality. And so there's expansion of the public hospital, People's Hospital, and there's also proposed expansion of the Iris O'Neil Clinic, and proposed expansion of development of a comprehensive clinic in the Eastern Outlook community, and further developments in other communities in the near future. So not only will we be improving the inputs, we are going to be able to audit the processes, and we are going to be able to make public and transparent reports about what transpired, what was deficient, what was not deficient, and what the corrective measures are, which is part of our responsibility to the public.
Additionally, the Ministry of Health is encouraging the public to lodge complaints with the BVI Health Services Authority's Performance Information Unit, which focuses on listening to the concerns and suggestions by patients and clients.
We are putting in place procedures for in the public sector for people to be able to lodge a complaint if they are dissatisfied with the service, and there are processes for investigating any complaints that are made. And we encourage people that if you felt that things didn't go as they should have gone, to make a complaint. And if you make a complaint, they have a written responsibility to respond within a certain time period and to give you a response. More and more we are accepting of the reality that when people perceive that something is not as good as it ought to be, that is in fact their reality. And we are beginning to understand that we need to take that literally and to engage directly with them, to have a dialogue, to understand what they perceive the shortcoming to be. And that is why we've established the complaint procedure, and we're asking people, if there is an issue, go to the health services, let them know what the difficulty is. If they don't know what you see as being wrong, they can't really address it.
The Spotlight interview with Chief Medical Officer Dr. Irad Potter and Roy Barry, the Deputy Director in the Social Security Board with responsibility for the National Health Insurance, will rebroadcast on Sunday at 2:30 p.m. and it is also available anytime on our website jtvlive.net. Meanwhile, the new state-of-the-art People's Hospital is nearing completion, and the keys to the 7th-floor facility is expected to be handed over shortly. In April, Health Minister Ronnie Skelton said the building was expected to be completed by the end of September 2013. Upon completion of the new hospital, a phased implementation process would begin to move services into the new building.